Dr. Carlos Calvosa, leading board-certified urologist from Costa Rica, talks about correction of sexual dysfunction in men and penile implants.
Sexual dysfunction in men is a very important pathology all over worldwide. And erection comes from with the blood that gets into the corpora cavernosa. This is a penile section. This is the corpora cavernosa, and this is the urethra or urine channel. So when you get an erection, blood comes into the corpora cavernosa, and then this is what is going to get the erection, the rigidity of the penis. But when we do penile implants or surgery for sexual dysfunction, here is where we put the cylinders that are going to be, or that are going to give a man an erection. So coming back here, this is what we call, penile implants. The penile implants that we use are these ones that we call 3 pieces penile implants. But this means is there are 2 cylinders that are going to get implanted here in the corpora cavernosa, a pump and a deflation system that's going to be in the scrotum between the testicles, and the reservoir that is going to be near the bladder. So what we do is a very small surgery where we are going to implant this type of systems. As you can see, this is the cylinders that are inside both corpora cavernosas, the pump that is going to be inside the scrotum between the testicles, and the reservoir that is going to be near the bladder. So all the systems is inside. When a man has this implant, what he does for having an erection is pumping this system here that's going to pull the solution or liquid to the cylinders, and then there's going to be an erection. This is what we call a penile prosthesis, and this penile prosthesis is the AMS 700CX penile prosthesis. And this is the one that we use here in Costa Rica to implant to a man with sexual impotence. These are 2 cylinders that are going to be placed right inside the corpora cavernosa, the pump that is going to be in between the testicles, and the reservoir that's going to be near the bladder. So when a man wants to have an erection, he's going to pump this system, as you can see, and he's going to have an erection through this system. When you're pumping here, you're taking the liquid or what we call the saline solutions that are going to go through the pump and right to the cylinders. When a man wants to deflate the system, instead of pumping here, he's going to deflate here the system, and it's going to deflate like this thing here. Okay? And that's the way it goes. When you deflate, so the liquid is running back to the pump and to the reservoir.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.